these are reasons why you shouldn't be stressed medically.
The diagnosis, symptoms, and treatment of various ailments expounded and demystified.
If you have peptic ulcer that is being treated, then you may want to avoid spicy foods because that increases the discomfort. Again, would advise that your meals are regular if you have peptic ulcer to prevent hunger pangs.
Okay.
So these are helpful lifestyle things.
Tune in to Doctor Who, our interactive health program here on Sweet Melodies 94.3 FM every Wednesday at 11 a.m. as our radio doctors dissect various topics pivotal to your health and well-being. Doctor Who. Saving every heartbeat.
Good morning, everyone, and you're welcome to today's edition of Doctor Who. This is our health show here on Sweet Melodies 94.3 FM. We seek to bring you everything concerning your health, and so we talk about various topics across, anything health related. And this morning we're in the studios again. I have with me here in the studios Dr. Stella Boame, and we're going to be talking about women's health. Dr. Stella, good morning. How are you doing?
Blessed.
Okay, it's awesome to have you again. And listeners, if you have any questions in the course of our discussion, you can send them through to 0279 100 That is 0279 100 600. So, Dr. Stella, women's health.
Yes.
What's there to know about women's health?
Women's health is, we want to talk generally about health for women. Okay, and the reason for that is not that we are trying to be special about women or something. I know it's not Mother's Day or anything.
Right.
But Dr. Anika Dremor has been talking quite a bit about women's health in different ways, a bit about infertility. I think she spoke about fibroids and different things, yes.
Right.
we are still in that trend, if you like.
Mm-hmm.
So we just want to talk generally about women and our health care and how to take care of yourself as a woman. Why is that important?
Right.
Let me just digress a bit and say that for men's health, we'll often talk about things like prostate disease, erectile dysfunction, and maybe something about sexual transmitted infections in the younger males. So there's that we could talk about. But today, we want to talk about women. And women's health is also important because the female body changes quite a bit throughout the lifespan. Okay. There's childhood and early teen years.
Right.
Then there's what we call the menarche, or the beginning of the periods, which is the end of puberty. Then after that, you sort of go through a fertile phase of your life, which is where we expect that you will have your babies and nurture them and do all those things. Right. Then there's the menopause, another big change, which takes you into the end parts of your life. So there's a sense in which there are big changes, each of them with big and small issues. So we want to talk about that. And apart from that, all these things happen to a human being. Right. So there's the general health that affects a woman also, that she shouldn't forget in the midst of trying to get married, trying to have babies, trying to take care of babies and a husband and all those things. So we just want to focus a bit on women's health.
So there seems to be a lot more to talk about when it comes to women's health.
So I'm sure we'll just touch on bits of it, but it's also just to make us mindful. Yes, that these are all important. So I think we'll start by talking about menarche. Let's say that children are children. So another time we'll talk about child health. Right. But today we'll talk about menarche first and mention the fact that it is, if you like, maybe I'll say the beginning of womanhood, isn't it? Because there's a girl and then she begins to show breast changes. Then she begins to have underarm hair, pubic hair. Her hips widen, so on and so forth. Then she has a period. So that point is what we call menarche. And from then you are fertile and could get pregnant and all the things that go with it. So around that part, from that time on, let me say that it's important for a woman to even be aware of your periods and your menstrual cycle. So it's important for a woman, it's part of a good thing for a woman to know that, for instance, I started to have my periods. Most people will go back and say, when I was in class 6 or something like that. So usually it's around any time between 11 and 13 years, usually. But it can be as early as 10 for some, and as late as even 15 for some. Now, if you are going beyond 14, it may be good to just have a health checkup, generally. I haven't had my periods, I'm 14 years old. It may be good to take your daughter for a checkup to just be sure that all is well. Now, very early changes, just to go back a little bit. If your child has started to have her breasts enlarging from 8 years and on, that is the beginning of the puberty changes. So it's, if you just have a little breast bud, it's okay. 8 years old, 9 years old. But if these are developing, you are beginning to see hairs and you're beginning to see signs that the puberty is really happening, it's good to see your healthcare provider, your pediatrician, or wherever you get your primary health care. Because there is such a thing as precocious puberty, in which the girl attains puberty too quickly and goes all the way to the point where she has her first period too early. Let's say 10 and below, depending on your body build. The main disadvantage of this is that once you have your periods, very soon your bones fuse, and then your height, you cannot grow much taller.
Your bones fuse, what does that mean?
Well, growing children have, at the joints, the bones are not all fully fused. There's a lot more cartilage in babies and children than in adults. So there's what we call the growth plates at the end of the long bones, and in several other places. So you keep growing, and there's space. Or there's, provision is made for growth. There's a factory in the bone that keeps growing.
Okay.
So once you pass puberty, these things fuse. I mean, it's like you finished. So that's it. That's your height.
Okay.
And that's why we try to delay puberty a little bit so that you can grow a little more. So if your child at a younger age, let's say below 9, is beginning to show more secondary sexual characteristics that may be a little breast bud, then just let your health provider see. Usually they'll do a review later on, and if it's necessary, you'll do some hormonal tests. They are very expensive injections to delay it if that is required. Okay. So having said that, we'll move back into the women's health.
Okay.
So we've talked about the periods. So it's important to know when your period started. Okay, that may be necessary later on in life when we are looking at your health risks, and we want to see for how long you've been having regular periods. Okay. Because regular periods means that you've had a long exposure. Your body has had a long exposure to estrogens, to progesterones. So we sort of want to have an idea of that. So we may ask you later in life. Just note it somewhere at the back of your mind when period started. Then the length of your cycle. Let's say I bleed for 4 days, and after 26 days, I have another period. Okay, I'm sure Dr. Anika has mentioned it at some point, if you've been listening. But it's good to know how many days does the period last. And if I started my period today on the 1st, on what date would another period start? Okay, so these are also good facts to know for all your women's health needs later on. Okay, so your periods are important. We won't go too much into the menstrual cycle, just to say that you need to have a period even to have babies. Right. So if your periods are too irregular, too heavy, you miss 3 months, then one comes. When it comes, the last 2 weeks, anything that is out of the normal, up to 7 days of bleeding, approximately 3 to 4 weeks between periods. Anything different than that, please let your doctor know so that if there are any challenges, they are picked up early. So having said that, now we are in the main block of life, the fertile age or the maximum age of womanhood, if you like. So these are maybe the high point is the menstrual cycle again, when your estrogen and progesterone balance each other, so that you go through the cycles where you release an egg. If you don't get pregnant, you shed it in a period. If you do get pregnant, then that's another story altogether for the next 9 months. Okay. So, but during this period, you are still, as I said before, a human being, and you have your usual health needs. Okay. So I'll talk about a few things that are commoner to women. Okay. And the first thing would be menstrual problems, isn't it? So these are things like dysmenorrhea, painful periods, things like periods that are too heavy. Okay, so these sometimes need help, and sometimes you can find things like fibroids causing it. You can find things like polyps that are little growths on the cervix or in the uterus, which can bleed. So these are things that might be picked up later on in life. Things like cervical cancers may cause what we call contact bleeding. So you can bleed after intercourse. You can bleed, just out of the blue, you may bleed a little bit of bright red blood. And these are things that your gynecologist will be interested in to examine and to see if there's a problem that needs to be dealt with. Then we can also have things like, not so common here, but endometriosis. In fact, it's fairly common. Endometriosis is when you have tissue from inside the tissue that should be inside the uterus. Okay, when I say tissue, flesh that should be inside the uterus is found growing somewhere outside the uterus or outside the womb. Okay, so sometimes it's anywhere in the abdominal cavity. So it could be stuck to some of your intestines, it could be attached to the ovaries, it could be anywhere, sometimes in the upper organs like the liver or something, and you have a bit of uterine tissue in there. Now, the way the uterus functions is to become enlarged every month, preparing for a pregnancy. And if there's no pregnancy, then it sheds and forms a period. Okay. Now, that's fine if it's contained within your womb and coming out through the vagina as a period. But if it is stuck somewhere inside the body, then it becomes an irritant to the body. Okay. So every month there's this blood that appears somewhere in the body that it's not supposed to. So it irritates the tissue, the body fight, creates an immune response, and you get that on and on every month. So what tends to happen is very, very painful periods, okay, because these extrauterine tissues are also doing their own thing where they are not supposed to. So endometriosis is one of the problems. So if you notice anything that is happening specifically around the period when you're having your menses, you should also let your doctor know. We may pick up one of these things and we'll talk about it and deal with it. Okay. So those are things, a few of the things that would be related to the periods themselves. Maybe I should just mention premenstrual syndrome. That's when you have a bit of dysphoria, a bit of changed moods, changed affects, changed behaviors just before and maybe at the beginning of your period. So some people are depressed, some are irritable, a bit anxious, just before, and lack of concentration and so on, just before the period. If you add that to the bloating that sometimes you feel before a period, it can be a very uncomfortable season for ladies. Okay, and it can almost look like a monthly disease, till at a point you realize, I know this thing is really just related to the periods, and you can get help with it. Sometimes just simple counseling, sometimes just knowing that this is an entity that exists and I have to deal with it can help.
Okay, wonderful. I think we can look at a few questions that have come in because they're related to menarche. Okay, but the number, by the way, is 0279 100600. That's 0279 100 600. We're talking about women's health issues today here on Doctor Who. This one says, good morning, doctor. Please, my daughter is 7 years old and have begun to see spotting.
Breast enlargement, is there pubic hair and so on. Those would be more of a concern. But as it is, I would just see a doctor and have them examine. There may be things like irritation around the vagina or vulval area that is causing the bleeding. It may be from the urethra, where local area. So we should check it. It shouldn't be ignored.
Right. This one says, please, at which age is too late? After 14.
After 14, have a checkup and let's see what's going on.
All right. This is not related to menarche, but it says, please, can a woman after 40 have children? I've been told otherwise.
Soon after this, I'll talk about the menopause. But menopause is averagely around 45. Okay, so from the early 40s to about 50s to the mid 50s, menopause can start and end. Yes, so averagely it's said that from 51 or 52 years is the commonest age for the menopause. But it can be between the 40s and the 50s. Now, even while your body is transitioning into the menopause, you can have some periods. And when you have those periods, it means that you've ovulated and you can get pregnant. So 42 is possible. We don't encourage it medically, especially if you have other children. We are not going to encourage you to have your last baby or pension baby and all those things because the likelihood, the statistically, you are more likely to have children with birth defects if you have them later. The older you are, yes.
Okay, all right. 0279 100 600. That's 0279 100 600. Questions welcome on our discussion.
Okay, so now I think we'll talk, before we get to the menopause, we'll talk about general women's health. Or maybe this question related to the menopause. Let's do that. So after you've had your periods on and on and on and on and on for years, you've gotten pregnant, 2, 3, 4, 5 children in between. At a point, you may notice that your periods, to start with, sometimes they may get less. And for some ladies, they may get more heavy. So a little lighter than you're used to or a little heavier than you're used to. And that itself is not a problem. Very often you have people, even young people, coming into the clinic and saying that I've noticed that the quantity of my periods have reduced, although the number of days is the same and it comes every month. That is generally okay. Unless it's very, very drastically reduced, it's generally okay. But towards the menopause, you may notice a change. For some people, now they are bleeding very heavily. For some people, my bleeds have become much lighter. Okay. Now, the other thing that is even more common with more important for menopause is that you may begin to miss periods. Okay, so let's say you've always had very regular periods. Then you miss 2 months, and the third month it comes. Sometimes the same as every time, sometimes much heavier. And this may go on and on for about anything from a few months to a few years of this on and off period thing. Okay, now this is where it's noteworthy that it may come and go, but when you do get a period, it means you did ovulate and you could get pregnant. Okay, so even as you are in what we call the perimenopause or the transitional stage, you should use birth control if you do not want to be pregnant. Okay, because you could.
Okay.
Right. Now, this happens for, like I said, some years till at a point you do not have a period at all. Okay. Now, after 12 months of not having a period at all, we say that now you are menopausal. Okay. So the date of your menopause is 12 months after your last period. Okay. From that point on, it is menopause. Then after that, we say that you are postmenopausal or after menopause. Okay, yes. So 12 months after your last menstrual period, you become postmenopausal. Okay, now there are a few challenges. So perhaps we'll get into that now. After the menopause, what has happened is that the quote-unquote female hormones, the estrogen and progesterone production is much reduced. In fact, it declines in those months and years when you kept having your periods less and less regularly. Okay, as you were missing periods, it meant that the hormones were reduced in their concentrations, and so sometimes you just could not ovulate and have a period. So at a point, those hormones really, really decline to the lowest possible levels, and then you don't have any periods anymore. So now you have the menopause. Now, these hormones have what they did in your body. Okay. For instance, they helped to keep the vagina lubricated a bit. Okay, so when they are not there, some ladies will have vaginal dryness and so on. Now, when the quantity of these hormones is reduced also, women tend to have these hot flashes. Okay, sudden heat in the whole body. Okay, so you notice that you are doing something and suddenly you are drenched in sweat. Okay, you are having a nice normal conversation and you are drenched in sweat. So you look as if you are even lying or something.
Oh gosh.
So
you feel the lie detector testing.
Totally.
Oh my goodness.
So all these things begin to happen. Sometimes you have mood changes. Sometimes you become irritable. And people at work start saying that it's your menopause that has come and so on. You know, all these things begin to happen. Yes, so there are changes in the mood, changes in sometimes sexuality, because vaginal dryness may make it more painful, and sometimes a reduction in the hormone levels means that there's decreased libido. That means there's decreased desire even to have sex and decreased response to sexual stimulation. So partners must be aware that it's not just irritability and some wayness, but there are changes that are happening. And in some cases, you may talk to your doctor, and there are things that can help. There are estrogen creams, there are hormone replacements, but these are not things you should really get over the counter, because if you have certain health risks, then your doctor may advise you to not use any hormone replacement. So it should be discussed properly with your gynecologist before you think about adjusting those things. So we've talked about the physical things, we've talked about the emotional or those things.
Can we look
can
at
happen.
a few questions before we continue?
Should.
This one says, good morning, doctor. I've been having serious pains during my period, and it affects my daily activities. I was diagnosed with an ovarian cyst, but was dealt with. But I still experience painful periods. What should I do now?
Okay, I think you should try and book to see a gynecologist. Okay, generally a GP would be able to take care of you, but you have sort of been through some things. You've had an ovarian cyst dealt with and all that, but you still have the problem. So speak with your gynecologist. Sometimes simple things like NSAIDs or things like ibuprofen and so on may help. If you take it very early, for instance, our gynecologist might recommend that take them on the first day or when you know you're about to start your period. Sometimes that alone can reduce the pain and sometimes even the heaviness of the bleeds. So it may be something very simple that will help. Sometimes you may need to, some people will even put you on the pill for a few months to regulate the cycle and to help the periods. But I would put that in the hands of a gynecologist so that you get the best care very early. It's also useful once you have the pain. You said it affects your activities. It's better to manage pain if you are ahead of the pain than if you are chasing the pain. Okay. So that means that what I mean is that if you know your periods are very painful, and especially if your cycle is regular, then you can go ahead of the pain. Okay, let's say you know that by all means, this Tuesday morning, my period will start. If not in the morning, by afternoon it will start. You can start your pain relief in the morning, okay, ahead of even seeing the blood. And that will make your pain relief a bit more effective. Okay. On the other hand, you may not be sure, it may not be totally regular. So at the first sign of a bleed, if you take the pain relief that has been recommended by your doctor, that is more effective than saying, let me see how it will go, or when I get home, or in a little bit, and so on. Then the pain kicks in, and it's harder to get a control of it. Okay. It's very unfortunate and inconvenient if your periods affect your activities, because at work and so on you look funny. If every month for 2 days you're going to be all over the place, I'm in pain, it's like, hey, what about the rest of the ladies who are working? So I think you should see a doctor quickly and sort of let's get a handle.
This one says, good morning, please. I had my second baby through CS. I'm breastfeeding, but my period hasn't showed up yet. It's been 8 months. Should I be worried?
No, don't be worried. Usually in the first 6 months, if you did breastfeed exclusively, it prevents ovulation. It's a type of birth control in itself. So it's not odd at all for you not to have a period. Till 8 months, you'll be breastfeeding quite a bit. So it's not too strange. For some, it stays till about a year, but then it comes.
Okay. This one says, please, can you be menstruating whilst ovulating?
Can you be menstruating whilst ovulating?
Yes.
Generally, no. You would ovulate, and then about 2 weeks later, you would menstruate. Yes, that's generally how it is. Some people have a shorter general cycle. Let's say your cycle length is 21 days. Okay, and you bleed for 7 days. Then by the end of your bleed, day 7, you would be 14 days from your next period. And that's when you would ovulate. You ovulate approximately 14 days to your next period. So for people with very short cycles, that can happen. Okay. And sometimes it can affect fertility. If you have a loose rule in your mind that after my period, I'll wait a few days, and then I'll be in my fertile period. You may miss that. So it's very important to know the dates and the times. Then when you see your doctor, if you need to see a doctor, those things can help us to help you better. So it's possible technically, but it's not usual.
Possible. All right. Okay, I think I'll open the phone lines at this point as well because of time. So if you want to call in, you can do that on 0279 100600. Same number, 0279 100 600. We're talking about women's health issues today on Dr. Who. I'm in the studios with Dr. Stella Boame. Okay, please go ahead, Dr. Stella.
So we're talking about menopause, so I'm going to go a little bit there because there can be health issues. Now, this is a woman who suddenly lost some of her protective hormones and is in that age group when sometimes we screen for medical conditions because they begin to come up. Okay, so it's important to note that the estrogens and the female hormones protect a lady to a certain extent from cardiovascular problems. So from the strokes and the heart attacks and so on, there's some protection that women have in that fertile age when they're having their periods. Okay, so after menopause, you may suddenly have a sharp increase in your risk, your health risks, okay? So it becomes a little more important to be mindful of a woman's health after your menopause. Okay, and different things can be affected. You are more likely to have heart issues, so you should manage your diet properly, manage your weight. Okay, around this time too, your metabolism may reduce. Okay, so you tend to gain more weight, even eating the same things that you used to eat. So you may have to manage your diet, take away some fatty things, replace it with some lean meats and so on, add on your veggies, all the things that we talk about. It may become a bit more important after your menopause to maintain your health. After your menopause also, increasingly, I realized that dentition is also important, because reading up, you see that some dental problems come up more because you are postmenopausal, because again, the hormones were protective and they helped you to produce more saliva, which apparently is very protective to the teeth. So after menopause, when that drops, you may have that. So your checkups should include that. Okay. Then your breast health, you should ensure that you are doing your breast exams. Even if you used to forget it during the younger years, it's even more important now that you check. So you don't have your period, so you can't say 1 week after my period, I'll check. So you can decide that the first day of the month or on my birth date every month, I'll check. So that you have some reminder to do the correct things. It's important to see your gynecologist periodically. They will give you a schedule so that if you need things like pap smears and so on, you go ahead and have it done. Bleeding. After your menopause, 12 months after your last period, we've said now that you're postmenopausal, you should not bleed vaginally ever again. And if you do, then your doctor wants to know about it. Okay, the tract infections also become more common. Now, this is common throughout the woman's life because the urethra of the female is shorter than the male. We've talked about it before in urine tract infections. Males have a long tube between the bladder and outside. Okay, passing through the penis lengthens some. But for the woman, out of the bladder, a very short distance, and you're outside. Okay, and so it's easier for fecal contaminants and other things to track up into the bladder and cause urine infection. So it's much commoner in ladies. They'll tell you, I used the washroom in the bathroom, I wasn't happy with it, and now I have a urine infection. It's much more common. So we should be mindful of it. Drink more water so that you rinse out your urethra more of back. Okay, and contaminate the vagina or the urethra where the urine comes from, and then you can have infections. So it should be front to back. Then finally, regarding...
Doesn't everybody do that though?
They should, but yes. Then finally, regarding urine infections, after menopause, that same absence of estrogen means that some of the protective things that happen in the vagina and the urethra to prevent infections are lost. So you may have more urine infections as well. So we should be mindful. Drinking more water and so on helps to avoid that.
Okay, all right. Let's look at some more questions.
Okay.
This one says, please, is it normal to start menstruating 7 days every month, and after a while you start menstruating 5 days? Is it normal to start menstruating 7 days every month, and after, so like the period while you're bleeding is 7 days, and then after a while
she noticed that it's 5 days instead of 7. Yes, we see that quite a few times, and it does. You go to hospital, just mention it to your doctor. Okay, that plus everything else in your medical history. If it suggests something, they will notice and take care of it. Yes, but I wouldn't rush to the hospital just because of that.
All right, great. The number once again is 0279 100600. If you want to call in as well, you can do that. 0279 100-600. We have a short window for calls, so please call in now if you want to. All right. Please go ahead.
Okay, so finally, I'm going to talk about bone health in that post-menopause period.
Right.
Okay, it's important for all of us. I haven't really talked about the general health. I want to finish the main female ones if there's time. So bone health, it's important to exercise throughout your life. Okay, but after the menopause, the reduction in the estrogens makes you more susceptible to osteoporosis. Osteoporosis is where the middle of your bones become less dense, become lighter than they used to be, because you are not putting in so much calcium into the bone, so you are not forming new bone. The bone.
Just a moment. Let's take this call and come. Hello. Good morning.
Hello. Good morning.
Hi. Good morning. What's your name, please, and where are you calling from?
My name is Augustina. I'm calling from Nsawam.
Okay, Augustina. Please go ahead with the question.
Okay. So I just wanted to ask the doctor that I'm on birth control, that's the IUD.
Okay.
And after that, I realized there's a change in my menstrual cycle.
Okay.
The number of days is okay. The flow is also okay, but it's shortened. So it used to be 28 days, but I'm kind of seeing like 25. And I want to ask if it's normal.
Okay. Yes, it's normal. It's normal for the birth control to adjust your cycles a bit.
I can't hear you.
You can't hear? Hello?
Okay, let me end the call and listen.
Yes. So it's common for the birth control, especially the hormonal ones, to adjust your period again a little. Okay, so that's one of the issues of women's health, actually, birth control. So the progesterone or the estrogen containing birth controls can affect your cycles. So some ladies will have shorter cycles, or they may bleed a little bit between periods, especially in the first few months when they started using birth control. Okay. Then some too, if you use it for a longer period, some ladies will stop bleeding, because if I didn't even ask which type of birth control she's using, but I'm going to talk about hormonal ones first now.
She said IUD.
She said IUD.
Yeah,
okay, it's not strange, and in fact, it may be the IUD. Some of them contain progesterone, some of them don't. So it can interrupt. It can change your cycle a bit. Reduce number of days. Some a little increased. Some for the first few months you may have spotting or bleeding between the periods. Let's say 2 weeks after you bleed a little. Then when it's time for the real period, you have it again. But it usually tends to settle after some months.
Okay, all right, great. This one says, good morning, Kweko. I want to ask doctor, if you don't see your menses, what should you do? Is it normal?
If you are in your
how old? Yeah.
Yes. If you've passed menarche, so now you have periods every month. In the teenage years, it's not strange. The first few years of your period, you can just miss a period for no reason. We don't know. Okay, the body is getting used to
and
it.
You're fine.
Yes, especially the first 2 years. That can happen and you're fine. Then with time, it becomes much more regular. Having said that, you should do a pregnancy test, just so that we are sure that's not what it is. Okay. Then later on, it becomes regular, and when it's become a regular cycle, once in a while you may miss it, but generally speaking, it should maintain that regularity till you become perimenopausal or transitioning into menopause. Okay, so every time you miss a period, if you are sexually active, then you should test for pregnancy first, obviously, yes. And if that is negative and you miss a second period, then please make an appointment, see a doctor, and let's find out why. Because apart from just the gynecological hormones, other issues in the body can affect your periods. Thyroid disease can affect it. Drastic weight loss can affect it. Severe stresses can affect it. So it is important to check if you suddenly out of the blue miss periods, which you never used to do.
Okay. Okay. She said she's past for the past 4 months, she's 50.
Okay. Then it's okay.
Okay.
Then it's okay.
All right.
Yes.
Great. Okay. I think I've exhausted all the questions, and our time is up, so we have to be wrapping up.
Okay. So I think we've said many of the things that are peculiar to women's health. Yes. I was talking about bone health after menopause. That is very important because the bones become more brittle. You are more likely to break a bone with a smaller accident than you used to when you were younger. When you were chasing your children around and falling because they've left their toys. It's a little different now, so you have to be more careful.
Right.
You need to take your calcium supplements. Please make sure that you are eating your diet properly, your vegetables, your proteins, your calcium supplements, so that you maintain optimum health.
Okay.
Omega-3s are good, so make sure you're getting it from your diet.
Okay.
Check and see if your diet has enough. If not, you may want to add supplements. It also helps bone and brain health.
Wonderful.
Okay. Drink your lots of water, prevent UTIs, and optimize your health.
Okay.
Use sunscreen to protect your skin.
Really?
Yes, because
black people in sunscreen, though, people don't seem to.
maybe if you're lighter skinned.